Good evening to one and all. How are you all? Today we will discuss about the continuation of the topic of heart. So in this topic, we'll discuss about the how to calculate the cardiac output. So first we have to know about the definition of the cardiac output. So cardiac the output is nothing but the amount of the blood that is releasing from the heart from each ventricle for 1 minute is called cardiac output. So cardiac output is equal to stroke volume into heart rate. So stroke volume is nothing but the amount of the blood that is releasing from the heart from each ventricle for each beat is called the stroke volume. And about the heart rate, number of beats per 1 minute is called heart rate. So let us see the person is having the stroke volume 70 ml, and normally for adult humans the heartbeat range is 72 times per minute. So heart rate is 72. So 70 into 72 is 5040 ml. When you are converting into liters, that is 5.04 liters. So for each minute, the heart will release 5 liters of the blood to distribute to different parts of our body. So let us see what is stroke volume. So stroke volume is nothing but end diastolic volume minus end systolic volume. So after the joint diastole, how much ml of blood will presenting in the each ventricle we are call it as end diastolic volume. So during the contraction phase of the ventricles, how much of blood from the ventricles it will move to the pulmonary artery and the aorta, that is end systolic volume. So let us take example of 120 ml of blood presenting in the end diastolic volume and 50 ml is going to pulmonary artery and also aorta. So if you subtract this one, you will get 70 ml. So the dimension here, that is a stroke volume. So after completing this one, the blood will move to different parts of our body by the use of blood vessels. So let us see, the blood vessels are of three types: arteries, veins, and capillaries. The first one, arteries. So arteries is made up of three layers. I mentioned here, tunica externa is the first layer, tunica media is the middle layer, and inner layer is tunica interna. So inside this one, there is the presence of the lumen. The lumen is narrow, and the artery is thick wall, and the flow of the blood is very fast, and also high pressure will be there. And when you go for the veins, veins also consisting of the same three layers: tunica externa, tunica media, and tunica interna. And the lumen is wide, and also this is thin walled, and less pressure, and flow of the blood is somewhat slow when compared to the arteries. And the next one is capillaries. Capillaries are also the blood vessels which will connect the arteries and the veins. Arteries are ends with capillaries, and veins are starting with capillaries. So capillaries are the single layer and made up of the simple squamous epithelial or endothelial layer consisting of the nucleus. So this is about the today video.